Morning's Women's Doctor, we are talking about SIDS, or Sudden Infant Death Syndrome. October is SIDS Awareness Month, and it refers to the unexpected, unexplained death of an infant less than a year old. It is the leading cause of death in children between ages 1 month and 1 year in the United States. Doctors at Mercy Medical Center say putting your baby to sleep on their back is key, along with making sure that everything is out of the crib. And Dr. Ashanti Woods from Mercy Medical Center is joining us this morning with some more information. Good morning. Thanks for joining us.
Good morning. Thank you for having us, Jennifer.
So one of the key types of information that people need to know is that there are no symptoms with this. Is that correct?
That is correct. SIDS typically happens in an otherwise healthy baby before the age of 1, and so that's why we want to give parents the prevention tips to stop this. It's a horrible tragedy. Our hearts go out to anyone who might be watching this segment who has had a child or a family member affected by SIDS.
Do we know yet if there are really any underlying conditions that can be associated with SIDS?
So we do think that there are some risk factors. Some risk factors may include prematurity. Risk factors can include multiple births, multiple babies. So that might mean if you are a twin or a triplet. But there are some other factors that play a role, to include if there's smoking, if there's decreased prenatal care, to include, sadly, if the parents are younger, so like teen parents or very young 20s. So there are some risk factors indeed that are tied with, we believe, SIDS.
Okay, so what can you do to give your baby the best shot of not succumbing to this horrible, horrible situation?
Absolutely. Well, always in pediatrics, we like to keep it easy, and if there is a acronym we can use, we like to use it. So we like to say A, B, C, D, and I'm going to even put an E on it. So A is going to be alone. We want babies to sleep alone. We don't want them sleeping with anyone else, no siblings, no pets. And in the case of twins or triplets, we do still want the baby sleeping alone. B, we want babies sleeping on their back. We see that when babies sleep on their stomachs, and babies sleep longer on their stomachs, which is why parents want to put them on their stomachs. But when babies sleep on their stomachs, for whatever reason, we see an uptick in SIDS. C, we want babies sleeping in their crib or a bassinet or a pack and play, but it needs to be a firm surface, anything with a firm surface. We don't want a soft surface. Soft surface increases the chance of suffocation. D, that's going to be do not smoke. So we mentioned earlier, smoking is a higher association. And then the E is going to be extra close to the parents, but in a separate space. So that simply means we think that children should be in the room with their parents until about 6 months of age, but we want them to be in a separate space. We want them in that crib or pack and play or bassinet. So A, B, C, D, and E, extra close to the parents, meaning just in their bedroom.
Talk about why putting your baby on your back is better than on the stomach, because the stomach used to be the old way to go, and there's that school of thought that if they regurgitate or throw up in the middle of the night, at least it's going out and down in that direction. And then I know a lot of parents worry about on the back, it would just sort of go back down the throat. Can you talk about that a little bit?
Absolutely. It's a great question. It comes to anatomy. You would think that on your stomach, as you mentioned, everything can come out of the mouth. I'm going to try to hold my fingers up. I'm not sure if you can see it, but the airway in the baby's throat, in front you have the trachea. Air goes to the lungs. Back you have the esophagus, the tube that's going to take food and drink and air to the stomach. When the baby is on their back, a lot of the food comes out, but not all of it. Because of gravity, it's going to come down, and that extra food will be in the esophagus tube into the stomach. Otherwise, have it forward like this, because of gravity, the food that doesn't come out of the mouth is going to go to the trachea and increases the risk for something called aspiration. And that's where food goes wrong, and that's where we get into trouble.
I have never seen it explained in just that way. Dr. Woods, thank you so much for joining us this morning. Really appreciate it.
Thank you for having us, and hi to all your viewers.
All right, you got it. And if you have any other questions or you'd like a referral, call 1-800-MD-MERCY. Real important information right there.